Metoprolol is one of the most widely used medications among the beta blockers. It is a selective beta-1 blocker, and it can be given to you to control hypertension. This medication can also reduce the risk of heart failure, particularly in people with reduced ejection fraction. Metoprolol has also proved useful in managing the symptoms of angina and protection after myocardial infarction. Being a beta blocker, it can also be used to control the cardiac arrhythmias, and it is useful in the treatment of atrial fibrillation. Metoprolol is available in two salt forms, tartrate and succinate. Metoprolol tartrate is a short-acting formulation that should be taken twice daily. In the form of succinate, metoprolol is available as an extended-release tablet. Therefore, it is typically taken once daily. This formulation is more preferred, especially in the management of heart failure. Even though it has more selectivity towards the beta-1 receptors, metoprolol can produce various effects due to its simulation of blocking the adrenergic system. It can affect your heart rate and your blood pressure. It enters into your brain, affecting your alertness. In this video, we will discuss the common side effects of metoprolol, how they occur, and how to manage them. The first side effect is the fatigue. Use of metoprolol can make you feel tired and weak. These side effects are very common, observed even with the first few doses. Since metoprolol is a selective beta-1 blocker, it reduces heart rate as well as pumping of the heart. Therefore, you may have the symptoms of fatigue due to the low blood supply to the systemic organs. This fatigue can be more pronounced when you're using this medication at higher doses. That's why you should not start it at higher doses. With such high doses, you may have significant fatigue even with the first dose. Therefore, always start at a low dose and gradually increase the dose so that your body can adjust to this medication and you may have less fatigue. Since metoprolol is a beta blocker, it can affect the functioning of your heart as well as your blood vessels. It blocks the beta-1 receptors on your heart, thereby reducing the rate of contraction. It blocks the effect of adrenaline acting on your heart through these beta-1 receptors. This results in the slowing of your heart rate, and it even reduces the force of contraction. This may help decrease the workload of your heart, which improves its efficacy in conditions like heart failure. However, the same mechanism is also responsible for the development of fatigue. Due to decreased pumping efficiency, it can pump less blood to the various organs in your body. With that, you may have a feeling of fatigue and weakness. Metoprolol also produces a relaxation of your blood vessels, leading to a drop in your blood pressure, which further adds to the symptoms of fatigue. Another reason for developing fatigue is due to its action on your brain, where it modulates your alertness and produces symptoms like fatigue. Even metoprolol can reduce the energy production in the skeletal muscle, leading to muscle weakness. However, the fatigue produced by metoprolol depends on the dose you are using. It may also be variable individually with their age, health conditions, and other medications that are taken. This fatigue may be enhanced if you have significant slowing of your heart rate or significant hypertension. If you're taking any other antihypertensive agents, this fatigue may be more enhanced. To minimize this fatigue, you have to start with the lowest effective dose. Maintain proper hydration and avoid alcohol. The second important side effect is the Brady Cardia. Metoprolol can reduce your heart rate. Normally, the heart rate ranges from 60 to 100 beats per minute. When this heart rate is reduced to less than 60 beats per minute, it is called Brady Cardia. This Brady Cardia can produce dizziness, fatigue, and lightheadedness. Therefore, while using metoprolol, if you observe any dizziness, try to monitor your heart rate and your blood pressure. Lowering of blood pressure can also produce symptoms like dizziness. The slowing of heart rate may be significant if you're using a higher dose of metoprolol initially. This effect can also be pronounced if you are adding any other antihypertensive medications that slow your heart rate. Metoprolol can be combined with other medications like diuretics such as hydrochlorothiazide, angiotensin receptor blockers like telmisartan, or calcium channel blockers like amlodipine. Amlodipine can also produce weakness if it is combined with metoprolol. Therefore, the dose should be slowly and properly adjusted. Even though ARBs are not directly acting on the heart, they can still slow your heart rate when they are combined with metoprolol. Therefore, be careful in monitoring your blood pressure when you're using 2 or more medications. You should be careful when your heart rate is persistently less than 50 beats per minute. Swelling of your legs and unexpected weight gain are indicators for worsening of your heart failure. Metoprolol can reduce your heart rate as well as force of contraction. Therefore, it can worsen the heart block. So it should be avoided in people with second and third degree heart block. The third side effect is hypotension. Metoprolol is actually indicated to reduce your blood pressure. But when this blood pressure is reduced to a significant level, it produces symptoms like dizziness, lightheadedness, and fainting. It may also produce orthostatic hypotension, leading to a risk of falling when you change your posture. Normally, when you're going to change your position, your blood pressure should be increased to withstand gravity. But whenever this metoprolol is used, this increase in blood pressure may not be maintained, leading to a risk of falling. Therefore, if you observe significant hypotension with the use of metoprolol, you have to reduce the dose. Try to avoid a sudden change in your position and stand slowly to avoid a sudden fall. You have to consult your doctor in case of severe dizziness or fainting. Another important side effect of metoprolol is cold extremities. With the use of metoprolol, you may observe a cold sensation in your hands and feet. This effect can be observed when you are using metoprolol at higher doses. This is due to its effect on your blood vessels. Metoprolol is a selective beta-1 blocker, and it mainly acts on your heart. However, at higher doses, the selectivity may be lost, and it can also act on the blood vessels supplying your skin and extremities. Beta-2 receptors are located on these blood vessels. At higher doses, metoprolol may also have some blocking action on beta-2 receptors. Normally, these beta-2 receptors are responsible for dilation of your blood vessels. This improves the blood flow, supplying heat to the extremities. But with the use of metoprolol, these beta-2 receptors are blocked, leading to a cold sensation in your hands and feet. However, the extent of the side effect is not common in all the people, and it is highly variable in the individuals. Particularly, the dose of metoprolol mainly influences the extent of this side effect. People with pre-existing conditions like poor circulation may have a more pronounced effect. Smoking and high consumption of caffeine can also increase this cold sensation in your hands and feet. If you observe this side effect, try to wear warm clothing and reduce the dose of metoprolol if this side effect is more troublesome. You can also switch to the extended-release metoprolol preparation, which delivers a lesser amount of this medication into your body, minimizing this side effect. Breathing problems. This is another effect of metoprolol due to loss of its selectivity. Use of metoprolol at higher doses can affect your lungs. Bronchioles are expressed with beta-2 receptors. Normally, these beta-2 receptors are responsible for dilation of your bronchioles, increasing the airflow. But when metoprolol is used at higher doses, it can produce a blocking action on these beta-2 receptors, leading to bronchoconstriction. This reduces the airflow, leading to a few symptoms like difficulty breathing and wheezing. However, such side effects are not observed in all the people. This side effect can be observed mainly in the people with pre-existing risk factors. Bronchospasm may be possible in people with reactive airway disease. If you have severe asthma or chronic obstructive pulmonary disease, metoprolol can produce difficulty breathing. In such conditions, you have to reduce the dose. You can also use an alternative beta blocker. But among the beta blockers, metoprolol is a highly selective beta-1 blocker with less effect on your lungs. Gastrointestinal disturbances. This is common with the use of metoprolol. This medication can produce nausea, constipation, or diarrhea. It can produce some stomach upset. These effects are mild, and they can be minimized by taking this medication along with food. Use of metoprolol can mask your hypoglycemic symptoms. So if you are diabetic, you may not notice the symptoms of hypoglycemia when you're using metoprolol. Therefore, monitor your blood sugar closely while using this medication. Sleep disturbances. Metoprolol can enter into your brain, and it can modulate a few of the stimulant pathways. This may result in the production of vivid dreams and sleep disturbances. This side effect can be minimized by reducing the dose or switching to an extended-release formulation, which produces less entry of this medication into the brain. Mood disturbances. Metoprolol can affect your mood. This may be due to its effect on the brain. It can produce the symptoms of depression, fatigue, and decreased energy. Metoprolol can enter into your brain, and it can block the activities of adrenaline and noradrenaline. Therefore, it blocks the stimulation of the adrenergic system. This may impair your mood, and it can produce depressive symptoms. It can also produce some vivid dreams and confusion. However, this side effect is having high individual variability. In people with any pre-existing mental conditions, these mood swings may be more observed. If you observe any significant depression of your mood, you have to avoid this medication and use an alternative exchange. If depression or mood changes impact your life, then it is better to switch this medication. Another side effect of metoprolol is sexual dysfunction. This is a rare condition that is produced by metoprolol. It can produce a loss of sexual desire, and in men it can produce erectile dysfunction. However, these side effects may be observed due to any other coexisting risk factors. When it is clearly associated with the use of metoprolol, the dose may be modified, or it may be switched to an alternative antihypertensive agent. These are the various side effects possible with the use of metoprolol. Share your experience and how it works for you in the comment section below. Please subscribe to our channel and hit the like button if you really like this video. Thanks for watching. Have a great day.